Well, good morning, everyone, and welcome to another live. We appreciate you guys, and we appreciate you coming on. If you can live, of course, we love it, and we understand not everybody can do that. And Brahim and Andrea, good morning to you guys. There's Mike. Michael, we missed you all week. Brahim was worried about you. John, how are you from Elgin, Illinois? And Janice from Brampton, good morning. Much appreciated. And let's see, Madeleine, how are you from Kipawa, Quebec? Bonjour. Nativity, good morning. Kevin from Oshawa. Denise Oakville, good morning to you. Rosalinda from the Kidneys of Canada, Niagara Falls. Wendy, Markham, Fran from Orangeville. Suzanne, good morning. Doris from Kitchener, good morning. Cheryl, West Virginia. Dave, Muskoka. John, good morning from Wyoming. Wanda, Ridgeway. Marvel, Ottawa, our nation's capital. Grace from Newfoundland. And who is that? I think that's Star. How are you? Nativity. Cecilia, good morning. Jeanette, how are you? From Ottawa. Wow. Faye, Terrace, British Columbia. Keith, good morning to you. Mara and Lynn, Minnesota. Nice to have you on. Donna, Newfoundland. Sue, good morning. Manitoulin Island. Gary, how are you? And Nina from Chatham. Diane, Thunder Bay. And Shirley, Twin Gate, Newfoundland. Douglas from Port Huron, Michigan. Kathy, how are you? Jeanette, how are you? Francis, good morning to you. Arlene, St. John's, Newfoundland. Suzanne, et Danielle, bonjour from Kapuskasing. Anne, Patricia from Calgary. Nancy, good morning. Gore's Landing. Denise. Okay, a couple more. We got a lot of questions to go through. Wanda from Virginia. Faye, nice to have you on. Rose, good morning to you. And 2 roses in a row, and one from Light Cove. Rita, how are you? And Leela from Burner. Laurie from Cambridge, and 2 more. Julie, Grand Bend. Well, that's beautiful there. Patricia, how are you? Carol, good morning. Good morning, good morning. Okay, let's get to our questions this morning. First one up is Patricia in Alberta. She said it's extremely hot. Well, you know what? In Northern Ontario, we're getting our summer still. I mean, yesterday was just a perfect day. Beautiful. Okay, and Patricia says, I sit mostly in the shade. Do I still get adequate amount of vitamin D sitting on my porch in the shade? No, you don't. But you do get good stuff. Just being outside, just being if the sun is out, you're getting melatonin. Your melatonin from your pineal glands. Your third eye is you're building up melatonin, so that's a good thing. As far as vitamin D is a finicky vitamin. You got to be in the sun to get vitamin D. Okay? And so, Patricia, here's what I always tell folks. It's not hard to get 10,000 IUs, you know. Even if it's hot. 20 minutes. Arms and legs. Those are your biggest solar panels. You get 10,000 IUs of vitamin D. And I really try and emphasize some sunbathing. When that sun's out, do some sunbathing. And you don't have to do it long. Then you can get in the shade. Okay? then you can get into shape. If you're 10 minutes, you're getting 5,000 IUs. 20 minutes, you're getting 10,000 IUs of vitamin D. And you can never overdose on vitamin D from the sun. You can't. Your body has a barrier, and you'll never get past it. Okay? And by the way, taking a supplement of vitamin D, believe you me, you know, you hear, oh, you can become toxic. They've never seen a case of it. They really haven't. I've been dealing with vitamin D for 50 years. I never saw a case. Oh, you took too much vitamin D. Look, I'm not telling you to take massive amounts of vitamin D, but the research is very clear. You'd have to take 50,000 IUs a day for 6 months. Who does that? Okay. Now, thank you, Patricia. Okay, Tracy is asking about bullous pemphigoid, which is an autoimmune. I got a lot of questions about autoimmune, okay, this morning. Now, can I tell you, Tracy, listen, anytime you get autoimmune, okay, anytime you have an autoimmune disorder, and you got to start by the gut. You have to start at the gut. I've never seen an exception to it when I was in practice. Anyone that came into my office that had any autoimmune, rheumatoid arthritis, Crohn's disease, ulcerative colitis, I've seen this a couple of times, bullous pemphigoid. Leave it to medicine to give it a name like that. Okay? Like, are you kidding? No, but you can't even pronounce it. Anyway, any autoimmune, I never saw an exception to it, started with leaky gut. So let me give you a little wee bit of what causes leaky gut. Because you just don't get leaky gut. Leaky gut is caused by certain things. Number one, the number one cause, in my opinion, of leaky gut is what? Antibiotics. Okay? Antibiotics is a double-edged sword. They can save your life, but they can give you autoimmune. And it takes years later. But I was a history guy. I was very, very, very focused in on patient histories. And it was, again, almost with no exception, when you saw autoimmune, you saw someone that took a lot of antibiotics in their lifetime, and especially when they were kids. For ear infections, recurring throat infections, tonsillitis, or whatever, or even later in life, they took antibiotics for acne, or they took antibiotics and then a year or two later, autoimmune. Kids, later, autoimmune. I'm telling you. Now, there's other factors. There's other things that cause leaky gut. Like even these artificial sugars. They disrupt the microbiome. And, you know, the amount of sugar that we consume, and especially high fructose corn syrup, disrupts the microbiome. Non-steroidal anti-inflammatories, people that live because of migraines or whatever, I don't blame them. Headaches all the time, their hormones are out of whack. You know how many women that I treated over the years, and they were on Advil or Tylenol, they lived on it. Because they had headaches all the time. And then years later, they develop autoimmune. Why? The disruption of the microbiome. Leaky gut. Leaky gut, leaky brain. Leaky gut, leaky skin. Leaky gut, leaky lungs. Leaky gut, leaky joints. And this is why these autoimmune diseases occur. And the Trojan horse comes in. I think I was the only guy talking about this, as far as I know. Because they did talk about a disruption in the microbiome, but they don't tell you the whole story. There's something that attacks the body in leaky gut. And that usually, and that's especially with antibiotics and that, you get a fungal or a yeast infection. It's the Trojan horse. It comes in. And now it comes in the bloodstream and it spreads all over the place and manifesting itself in different areas. The Trojan horse comes in. You get a fungal infection inside the body. The body responds to it by creating what we call a cytokine storm. And often this is the process of an autoimmune disease. No fun under the sun. Why do we see so much autoimmune today? Why has it gone up 300%? I'm a why? Why are things happening? Why is it worse? Why aren't we winning? Is there anything we're winning at these days when it comes to our health? Why are we losing? Why is our society so stinking sick? Why? Okay, I'm a why guy. Tracy, thanks for the... Morris, what products Dr. Martin offers to treat neuropathy? Well, if neuropathy is coming from diabetic neuropathy, I see that a lot. And I'm big on... when I see neuropathy, almost invariably, there is a lack of B12. The nerve vitamin is B12. Eat more steak, Morris. Take B12. I would have you on a treatment of Navitol, which is pine bark extract, and B12 for neuropathy. I used it in my office. I use it for diabetic retinopathy. I use it for, and plus high DHA. But generally with neuropathy, I'm looking at B12 and Navitol. And Navitol, why? Because it elevates your nitric oxide. It opens up your blood vessels. It relaxes them. Okay. Hello, Dale. Dale, see, you're going, Dale, you're asking me an autoimmune here, okay? It's a question about whether treatment for alopecia areata is treatable for my 30-year-old son who is losing patches of his hair, including eyebrow hair. Yeah, that's an autoimmune disorder. And he also had the condition where he's losing skin color and has white patches in his hands and arms. 2 different autoimmunes, yeah. And again, Dale, what I would do, if your son was in my office and I saw alopecia areata, I saw all sorts of skin disorders, and I would start at the gut, I would start them on the reset diet. I would, a 30-day diet, get rid of all the sugars, get rid of all the carbohydrates for 30 days. And fix leaky gut, probiotics. I'd have them on bone broth. And to fix the leaky gut with L-glutamine. I'd have them on digestive enzymes, because you got to really focus in on the gut. Really focus in on it. And, when you're having the reset, he's going to have a lot more protein, and especially the collagen protein with bone broth. I got very, very good results with alopecia. Really good results. But again, it's focusing in and getting at And, you know, I don't know your son's history, but I'm telling you, usually there's a history of antibiotics there or non-steroidal anti-inflammatories. And then you get a perfect storm, usually stress, cortisol, over a period of time, that pours gasoline on leaky gut. It pours gasoline on it. And the inflammatory process takes off, especially with the high levels of cortisol. Generally, I could write you a book about that kind of thing. You know, I remember a few patients saying, Doc, how did you know me? I said, you've been under a lot of stress, right? How do you know, Doc? No, I'm not a prophet nor the son of one. But I saw enough patients in my lifetime and took histories, and generally autoimmune, there's a perfect storm that takes place. Leaky starts with leaky gut, and there's usually some pretty high stress situations that sort of light the fire, if you know what I mean, or pour gasoline on the fire. There you go. Thank you very much. And there's Gwen. See, this is another question about autoimmune. Thank you, Gwen. Thank you for asking, because people are interested. My granddaughter has lupus. Okay. Tough sledding. Now, with lupus, you'd have to be careful about the sun. So it's not sun, steak, and steel. It's certainly steak. But the sun, with lupus, usually you got to stay out of it. But she needs to be taking vitamin D. Okay? And fix the leaky gut with lupus. Okay? Fix the leaky gut. Get rid of that fungus. I've never seen an exception to it. Don't feed the bears. Like, the diet is very important. Broad spectrum probiotics. They're usually in lupus, low in B12. They're low in vitamin D. They're usually low in vitamin A. They're usually low in zinc. That's been my experience with that. I'm just telling you my experience. Okay, thank you for the question, Gwen. Laura did the carnivore for 6 years. Okay, and then did the reset. Now I have acid reflux, and the only thing changed is taking supplements and progesterone. Could it be progesterone? No. I've never heard of that ever, that taking progesterone, if you're taking, I don't know, how are you taking it, orally, or are you taking a bioidentical progesterone? That would be helpful, Laura, for me to know, but not because of acid reflux. I don't know how old you are, Laura, but as we get older, our digestive tract, our stomach especially, we can lose acidity in it. And it's not like you weren't using your stomach to eat meat. It sounds like you're a meat eater, and good for you. Smart girl. But acid reflux, you're probably not making enough pancreatic enzymes, especially I would think you're not making enough either lipase or protease, and you need to replace that. You should be on digestive enzymes like American Express. Don't leave home without them. Every meal, take digestive enzymes. Somebody asked, let me ask, because I saw a question about bromelain. Where is that? Somebody asked about bromelain. Because I might as well answer it now. I can't find it. I can't find it. Okay. I'll answer it when I get there. But you need to be on digestive enzyme. Oh, there's Tammy. What do you think of bromelain? I like it. It helps. Bromelain helps your digestive system. I like proteolytic enzymes. I like digestive enzymes. And bromelain, I got no problem with at all. It helps with the stomach big time to digest food. I like it. Okay. Okay, that was Laura. Betty, what causes clubbed nails? Well, whenever I saw clubbed nails in the office, I was looking at the digestive tract, but especially the stomach. Usually low acidity is one of the things. They don't have enough acidity in their stomach, and they're not digesting vitamin A properly. They're not digesting B12. They're not digesting protein properly. So digestive enzymes would be one of them. The other thing, club nails, again, club nails can be low, like what we used to call, well, still call it, I guess. I never used the term much, but hypoxia, low oxygen levels, perhaps low ferritin, low hemoglobin. And, you're sucking for air for some people, in congestive heart failure and COPD or whatever can cause clubbed nails. Okay, I used to look at nails all the time. And if you didn't have your socks on, you were in sandals, I'd look at your toenails too. Okay, thanks for the question. Much appreciated. Okay, and that was Betty. Tammy, I answered your question. Diane, facial neuralgia. Usually have pain 2 or 3 times a year. Well, usually, Diane, this is me. Usually you've got a pinch in your nerve in your neck. That'll give you a facial. Now, you might have a virus. Sometimes a virus can cause, Bell's palsy or facial neuralgia and low levels of B12, but you might want to see a chiropractor if you get that, because a lot of times you get nerve impingement. Okay, thanks, Diane. Grace, what does Dr. Martin think of the Dutch test to determine the root cause of hormonal health and issues? I would say it's a tool. Grace, I never relied only on testing. I used to do testing, by the way, and I used to order, you got to go way back, Dutch testing. Testing's not everything. You need to do, especially symptoms. Okay? Because the Dutch tests can throw you off in a sense. They come back and, I used to look at the results, and I never looked at the results without looking at symptoms with it. Okay? You gotta, testing, even Dutch testing, doesn't trump symptoms. Symptoms come first when it comes to hormones. And yeah, testing, but I'll give you an example. I get testing back and estrogen was down. Okay, and I've answered this question before, but I'll repeat it. Well, Dr. Martin, if my estrogen is down, why aren't you giving me estrogen? Well, I never give estrogen. Because your estrogen is down in your bloodstream. But your estrogen's not down in your total body. Because we live in a world of estrogen. And I never gave estrogen. I used to balance estrogen with progesterone, elevating progesterone. So I often did 2 things in the office. One of them was bringing down xenoestrogens. Because it's so dominant. Men and women. Breast cancer, ovarian cancer, uterine cancer, any female cancer, too much estrogen. Too much. Never too little. Never too little. And so you get Dutch testing back, and you're finding that the estrogen you have to look at all of it. You got to look at, and guys, you've seen me do this before. Maybe I have it on this notepad. Maybe I do, and maybe I don't. I don't have it on this one. But I'd always draw a pyramid. I used to do this in my office with every patient, just about. I draw a pyramid. I'm going to do one right now, and I flunked art. I'm just going to put circles, and I put 1, 2, 3, 4, 5, 6 circles. And I would turn it around to the patient on the pyramid. Okay, maybe you guys can see it, maybe you can't. And I'd say, you see your thyroid? You see your pancreas? You see your adrenals? And you see your ovaries? And for men, your testes? This has got to be balanced. And they all work together. And that's why I like testing. I'm not against testing. I certainly wasn't against the Dutch test. But I found most practitioners, most doctors, most gurus, they never put it all together. So they didn't realize that, the thyroid, they only tested the thyroid. Your thyroid's within normal. Your TSH is good. Your panel on your thyroid is all right. Yeah, but I got every thyroid symptom. That's more important than the test. And often I would see estrogen dominance, and the testing wouldn't show me that, but their symptoms did. And I always talked, I didn't care what kind of hormone it was. I said, you see that guy in the middle? That's called insulin. And boy, does that have an effect on your thyroid. It has an effect on your adrenals. It has an effect on your ovaries. And it certainly has an effect on your testosterone, men. And so you got to look at the whole package. That's my point. You have to look at the whole package. But I got no problem getting tested with the Dutch test. Arlene, how can you deal with poison ivy rash naturally? Oil of oregano, put it right on there. It's amazing. It's amazing. Oil of oregano and probiotics on the inside. And oil of oregano inside too. That was Arlene. Noeline. Is it more healthy to eat adult cows or veal? That's a good question. They're both good. Veal is baby calves, right? Well, veal's good. I like veal. Okay? I like steak better, though. But as far as nutrition, veal's very good for you. Okay? Veal is very good for you. Probably not. I don't know. I don't know. I'm trying to think if that would be any real difference. Nah, probably not. Not appreciably. Okay, thanks, Noeline. Never thought of it. Janelle says, I just watched the video on understanding cholesterol derangement syndrome. Okay. I don't even think that's been made into a podcast yet. Okay. And Dr. Martin mentioned the mitochondria in the brain. Yep. As well as the heart. Yep. My question is, does stress kill the mitochondria in the brain, heart, and gut? And if so, can it be reestablished, and how? Well, yeah, you can always reestablish, regenerate. Your body has an amazing capacity to regenerate itself. Amazing capacity. Okay? So, yeah, you can always regenerate. And your mitochondria are your battery packs. Energy. Okay? Energy. And your brain has the most mitochondria because it uses 25% of all your energy. It's headquarters. It's the federal government. It takes 25% of the food that you eat. And unfortunately, most people are overeating and underfed. They're undernourished. The mitochondria in your brain and heart and everywhere else are crying out, hello, you out there, would you please give me some real food with real vitamins and real macros and real minerals? Because people today, they live devoid of that. They're overfed and undernourished. And the mitochondria, look, the mitochondria, the battery packs produce energy from the food that you eat. And people are walking around and on low fuel. As a matter of fact, there's the majority of people walk around and they're running on fumes. That's why I want people to do the reset, because the reset will change the fuel. If you want to regenerate your mitochondria, then change fuels. I'm big on that. Your mitochondria will be giving you high fives. You're giving it 99% octane. There will be less waste. There'll be less waste material. There'll be less oxidation in the brain. Less free radicals in the brain. You need that. Change fuels. It's so important for your mitochondrial health. Your cells will thank you. I used to tell people, give me 30 days of your life and trust me for 30 days. Do you trust me? You waited 6 months to see me. Do you trust me now? Change your fuels. It's the one thing you can control for sure. What is that? What you put in your mouth every day. And you know, people they live to eat rather than eat to live. And that's the world we live in today. And most foods are so devoid of fuel because they're not near enough protein, not near enough amino acids, not near enough B12 and vitamin A and vitamin D in the foods and vitamin K2. They don't get enough of it. Beautiful question. Okay, thank you, Janelle. Rafaela, what can be done for stones? Well, look, kidney stones. Watch your oxalates. Gallbladder stones. Use it or you lose it. When I did this probably on a radio show, I don't know, 20 years ago. I said, use it or lose it for gallbladder, and people lost it at the time. People were angry with what I said. I said, well, your gallbladder, God gave you a gallbladder. It was meant to be used. And your gallbladder is a reservoir for bile. And bile emulsifies fat. And you need it for fat-soluble vitamins like vitamin A and vitamin D and vitamin K. God gave you a gallbladder to use it. And if you don't use it, well, Doc, what do you mean I'm not using my gallbladder? I said, what are you eating? Salad, cereal, grains. I said, yeah, you're not using your gallbladder. You want that saturated fat found in the animal kingdom. Dairy fat, cow fat, bacon fat. You're meant to eat it. And most people don't eat near enough. And so their gallbladder sits with this bile in it, and it forms stones if you don't use it. Your kidneys, on the other hand, where you get kidney stones, people are eating way too much salad and oxalates and almonds, and they're drinking these green juices. And I tell them, what are you drinking that for? Well, my guru said that green makes me alkaline. That's why I'm drinking it. I said, yeah, but you're forming stones in your kidneys. Drink water and coffee and leave the green juices behind. That's propaganda, not science. You're drinking glass. What? Oxalates. Little wee teensy weensy pieces of glass. And your kidneys don't like that. Drink water. Flush out your kidneys. Niagara Falls. Flush, flush, flush. Thanks for the question. That was Rafaela. Thank you. And let's see. Let's do one or so more. Carol, what causes problems for the lymphatic system? Well, one of the things, lymphatics is movement. When you don't move, we live in a very sedentary world. We sit too long, right? We do. TV, computers. 100 years ago, most people were moving. Their job demanded it. Not anymore. We're very sedentary people. That's one of the biggest problems with the lymphatics. Just move. Okay? Now, I want to bring you upstairs to the most important lymphatics that you own. They're called glymphatics, and that's in your brain. And in order for your glymphatics to work, to detoxify the brain, your self-cleaning oven, you need to be sleeping. That's why I wrote the book, and I've written much on sleep in several other books: Sun, Steak, Steel, and Sleep. Okay? You know when your lymphatics work? When you move. And when you sleep. Yeah, even lying down, but you're sleeping. You're not getting any data in. You're in airplane mode in your body. Data's not coming in. Your body knows how to detoxify itself. The night shift comes in to clean, and they send it out through the lymphatics. Okay? Isn't that neat how your body works? But you need to be sleeping. Move during the day and sleep. I love the rebounder. I've talked to you about that before. That is so good for your lymphatics. A rebounder. And even if you get older, get one with a rail so that you can hold on and just jump. Okay? I love the rebounder. Okay. Let's maybe stop it here. Yeah, okay. How many? Because I got too many now. I've got to do a question and answer Monday. Okay. Were you having fun? Thanks, guys. You guys are so good. I love the questions. I love it. I love it. I love it. Yeah. Anyway, keep sending questions in, by the way. And if you, like I mentioned this week, and I think it's important to remember that, sometimes you're going to ask questions right here live. And I can't see it, guys. When I do my program, once I start and I say hello to you, I can't see the questions you're asking. I really, like, it's over on the other side and it goes by too fast. I can't even answer those questions. And you're asking a question. I want you to ask questions. But if you could you put it in an email to info@martinclinic.com? I promise we'll get to your questions. Okay? info@martinclinic.com. It gets to me. We get to answer questions for you. Okay, guys, we love you dearly. We'll talk to you soon.